want to bring in Dr. Peter McCullough. Now, you talk about truth to power. You talk about still the finger pointing on COVID. You know, Lula's trying to make it the issue down in the Brazilian campaign, Dr. McCullough. But we still have so much unfinished business here about what actually happened, what was truth, what was not, the economic carnage, and particularly the vaccines. You've written an entire book about this. Walk me through your book for a second, because here we're going to actually show in a second a clip from the new movie that's out today, The Real Anthony Fauci, based on Bobby Kennedy's book. But you've gone this from day one, and quite frankly, you kind of went from, I don't want to say an insider, but a respected member of the medical community to really kind of a pariah, because you refused to buckle to kind of the mainstream thinking about this. Can you walk us through it?
Yeah, sure, Steve. I was fully a member of academia in the ivory tower, but things started to go bad and I couldn't sit by and watch it happen. I teamed up with best-selling author John Leake. It took us a year to write Courage to Face COVID-19, Preventing Hospitalizations and Deaths While Battling the Biopharmaceutical Complex. This follows on some excellent books, including COVID-19 and the Global Predators by Peter Breggin, which gives the timeline and so many of the factual details, the fact pattern and what happens. The Real Anthony Fauci, zeroing in on our National Allergy Immunology Infectious Disease Branch Director, Dr. Anthony Fauci. It was written by Robert F. Kennedy. As you pointed out, the movie premieres actually starts today. I play a few brief clips in that movie. And, I can tell you in our book, what we've identified, Steve, is there's a biopharmaceutical complex. It's basically like a syndicate, similar to the old military industrial complex. But this biopharmaceutical complex, at the very top, we believe, is the World Economic Forum, the World Health Organization, Gates Foundation, the Rockefeller Foundation, Wellcome Trust, and then all the subsidiaries, CEPI, Coalition for Epidemic Preparedness and Innovation, Gavi, Unite, the EcoHealth Alliance. All the agencies are now in regulatory capture, MHRA, THA, the TGA in Australia, CDC, NIH, FDA. And then there's suppliers, Big Pharma. All the entities now have massive flows of cash because the doors of the treasuries have been opened by this syndicate by declaring and then maintaining infectious disease emergencies, by which the money can then be basically flowed through pre-purchase of products, really in a sense fueling economically all the interests of this biopharmaceutical complex at the expense and sadly of also the tremendous casualties of hospitalizations and deaths of the population worldwide.
Here's what's stunning. In your book, it's the courage. It's also your personal courage to be able to face it. Not just the country have to face it, but that's why I think your book about the courage to face COVID-19 is so powerful. In the Robert F. Kennedy book, when it first came out, what shocked me was how this has been around for a while. It's been building. I mean, clearly it's worse now, but it's been building for a while. Walk me through, why did you participate in this movie? What was it about Anthony Fauci that really galvanized your thinking to have you want to be a part of the film about the book?
He's a central leader in this syndicate where this flow of money goes in part from the National Institutes of Health to a whole variety of centers. I think a lot of Americans had no idea that U.S. dollars were flowing through the University of North Carolina, Chapel Hill, Harvard, a Swiss institute, through the EcoHealth Alliance, which is a go-between organization. And the money actually landed in the biosecurity level 4 lab in Wuhan, China. And money was sent there specifically to carry out U.S. projects in this biosecurity lab. The lab itself was built by BioMérieux under the direction of Stéphane Bancel, who's now the current CEO of Moderna. We know the former FDA chairman, Stephen Hahn, he works for the venture capital firm that funds Moderna. The former FDA chairman before him, Scott Gottlieb, he's on the board of Pfizer, a vaccine supplier. So you can see the wide open conflict of interest, this web of stakeholders that is profiting greatly from these infectious disease pandemics, and then the single response to them being mass vaccination.
It's from the book that sold over 1 million copies, The Real Anthony Fauci. Dr. P. McCullough, when you watch that trailer, it's almost like you're getting ready to watch a horror movie. Tell me about that. It's almost like your power is like some Kafkaesque. They've made it from a Kafkaesque novel, and you're about to be sucked into something like a Hitchcock, where you have absolutely no control, no power, but you're just sucked into this web of power and corruption. What are your thoughts?
Americans do feel like the last 3 years has been a bad movie, Steve. 10 million Americans hospitalized, 1 million people lost their lives either directly due to the virus or with the virus. Myself and other doctors, we knew this was treatable. We knew we could develop ways to treat it. In fact, we did. We proved that they worked. We did everything we could to save as many Americans as possible. But the government narrative driven by Dr. Anthony Fauci was a narrative that basically promoted fear, suffering, hospitalizations, and deaths, and only a single answer, and that was to take a vaccine. And it was a vaccine that was proven to not be safe, and not, on top of that, not effective and didn't last very long. And now people, their lives have been ruined by these vaccines. Their careers are tethered to these vaccines, and there is no reconciliation of what's gone on. There's no admission that the vaccines have failed and that we need to jettison these products and now start to repair America. In fact, President Biden has just extended the emergency again. There is no emergency, Steve. We should just close this out, let doctors treat the remaining cases, and now start to invest in vaccine injury research and start to figure out what went wrong with this terrible plan.
Part of the reason we're going to have this sweeping victory is this issue of medical freedom that's bringing so many people to our side. Of course, the mainstream media doesn't want to talk about it. What do you hope with your book and your expertise, and you've already given some brilliant testimony to the Senate subcommittees run by the Republicans, but when the Ron Johnsons are in charge and the Rand Pauls are in charge, and you've got in the House, we have a 40 or 50 seat majority next January, February, March. What would give us, we got about 2 minutes. Walk through Dr. Peter McCullough's, given this movie, your book, Robert F. Kennedy's, the Children's Health Defense, all of it. What would you like to see? What's the outcome?
We need congressional oversight committees and hearings on what the FDA knew, what the vaccine manufacturers knew, why weren't the vaccines stopped? Pfizer should have been stopped within a month of its being released. 1,223 deaths occurred shortly after Pfizer was used in the public program, why there were no safety meetings every month to inform Americans and doctors how to navigate here. And then we need Senate hearings, and we clearly need them for all of the federal health agency officials, CDC officials, White House Task Force, NIH. We need them to be called to accountability and justice.
Dr. McCullough, it's the realanthonyfaucimovie.com. Everybody can see it free today. I want everybody to go there. Dr. McCullough, how do people get to your book, The Courage to Face COVID-19, and how do people follow you on social media?
The book has its own website, couragetofacecovid.com. You can follow me from my website, petermcculloughmd.com. I'm active on Getter, on Telegram, and I've just started a Substack with best-selling author John Leake. It's termed Courageous Discourse, and it's already very popular. My Twitter is still in suspension, trying to negotiate out of that. But as you all know, the social media onslaught against doctors telling the truth has been relentless.